I will talk about falling fertility in low and middle income group countries and what action need to be taken. Now, India is now the most populous country. We all know about it, and we find that the birth rates are declining, and we feel it is a welcome thing that the birth rate in this particular populous country is declining. We must plan proactively to avoid future demographic crisis, which is not far away. India fertility rate has dropped from, it was 6 in 1947. It was 5.7 in 1950 and 2 in 2023. And whenever it is less than 2.1, it is below replacement level, which is a sign of an aging population for any country. The government of India says that in 2025, India fertility rate is 2. Earlier, it was shown that it was probably going at 1.9, but the latest is it is 2. The UN projection, the slide need to be concentrated upon. The UN projection for India is that the fertility rate may drop to 1.29 by 2050 and 1.19 by 2100, matching Japan and South Korea levels. I will show it again. It was 6 in 1947, and in 2025, in fact, last 4 or 5 years, it is stuck up at 2. And UN projection is 1.29 by 250 and 1.19 by 2100. 17 states in India already have fertility rates below replacement level, including Delhi, Tamil Nadu, Kerala, Punjab, and many others. Now, aging population, it is expected by 2050. Over 20% of Indians will be 60 plus. This will give a lot of pressure, as just now Brigadier Sharma has highlighted, on health system, on the pension money, and caregiving support to these elderly. Infertility affects 1 in 6 couples globally. This is WHO 2023, a silent but growing health issue. As far as India is concerned, it affects 15 to 20%, that is every fifth person is infertile. Mostly due to lifestyle, age, infections, and delayed marriage these days. Only 1 out of 5 couples with infertility seek treatment. 1 out of 5 couples with infertility seek treatment due to lack of awareness, cost, or stigma. Fertility decreases sharply after 35 in women. Earlier in Bharat, it is said to be 3 to 4 years earlier in India, the fertility declines in female. Yet over 40% of the women in metros marry after 30 now. 40% marry late. Male infertility contributes to nearly 40% of all cases, and yet male remain under-investigated, under-discussed, and under-diagnosed. Why time to act is now? The fertility window is shrinking because they're marrying late. The biological age matters more than the calendar age, and the young people must be educated right in the school and the college that the best time to have fertility is less than 30 years. In fact, to be very exact, the best time for a female to have a child is between 20 to 25, most easy, effortless. Late parenting planning is being done because every girl wants to be educated, every girl wants to be economically independent, have to make a mark for herself in a career. So the egg freezing is an option. But very few women know this in India. Only 3% uptake among the eligible women is there, and the employer should help and encourage them. It has to scale up. Now, when we are talking about egg freezing, I just wish to tell you, people invariably these days come for egg freezing at the age of 40, 41, 42. That's not the age. In case you have to freeze eggs, you have to do it while you are young, preferably around 30 years. Then you'll find that the pregnancy rate with those frozen eggs is exactly the same if you were trying for a baby at age 30. India has less than 2,000 registered ART clinics with the new scheme and things which have come. And over 60 million infertile couples are there. And you can see, access gap is enormous. We also know that IVF is costly. IVF success rate is also 35 to 40%, even in the best of the settings. The prevention and early intervention are better. Subsidized IVF treatment has to be done as is done in Israel and Europe, and it should be considered very seriously. Because IVF is costly, micro loans for health need to be given, as it has been given for work in Bangladesh. In fact, our government has also started giving small micro loans to ladies as well as to the boys. Community sperm and egg banking in Iran has taken away the stigma as far as the donor sperms and the eggs are concerned. Grandparents are given a child care stipends both in China as well as in Japan. So again, once the couple knows that there is somebody to take care, and who can be better than the grandparents in case if system is evolved for child care stipends for these old people. Public-private partnership in Thailand has also made IVF treatment cheaper. Now, we also know that the malnutrition, anemia, polycystic ovarian disease, hypothyroidism all impact infertility, fertility. The woman's health must be optimized well before conception. Now, here I'm a very strong believer. I do not know how many of you are also believe the same. I feel the food from outside, the kind of oil which is used, the kind of masalas which are used in preparing that food, which looks very tasty, is very dangerous for the gametes. And the trans fat, all of us know about it. Whenever the oil goes at a very high temperature, it turns into trans fat. And that is very dangerous for both gametes in the male and a female. Infertility causes mental health issues as well: depression, stress, social isolation, especially for women due to cultural pressure to have a baby. The mental stress is found in infertile men as well, and ये वो बात अलग है कि वो उसको express नहीं करते, but when in private they do express it. Men and women both need preconception counseling to correct myths and optimize health. Now, as for the environmental toxins are concerned, I think, and endocrine disruptors are concerned, I can see that in the last 2-3 years, a lot of talks have gone on these topics because as you can see that increased arsenic level are there because of natural way in the underground water, but so much of plastics and cosmetics which are used by people, you can find that these can be, very detrimental in reducing the sperm number and the quality. It's a very big public health concern, and all of us have to put attention on it, that we decrease their use and how to curb these two problems of environmental toxins and endocrine disruptors. Smoking, alcohol, obesity all are increasing in our population, and we all know that they harm fertility significantly. Simple lifestyle changes can prevent infertility problems. Outside food, just now I told you, harms fertility significantly. Simple home food, curbing carbs and increasing little protein can prevent infertility. Digital infertility literacy is less than 20% in urban educated couples. Urgent need for digital awareness tools is needed to create awareness among the youngsters and the rural areas. Awareness campaign is badly needed, and telemedicine help can also be given to the people who are staying in a far-flung areas. Free fertility screening should be considered in rural Bharat under Ayushman scheme. How we must act together? Every doctor must include basic fertility education in checkups. Whenever you see patients, just like blood pressure, sugar, breast examination, fertility, we need to counsel these people about the fertility period, the best age to have a child and the best age to freeze the eggs. Gynecologists, pediatricians, and educators must talk about reproductive health early, even to adolescents and young adults. NGOs must include infertility in women's health programs, especially in urban, suburbs, and in rural India. Government may offer subsidized fertility diagnostics when pressing need arises, like doing an AMH, semen analysis, etc. Make early detection accessible. School and colleges curriculum should include fertility literacy module and remove the myths and add science in their knowledge. Insurance for fertility treatment must become universal in Bharat. Currently, very, very limited coverage is seen in India. And we have to promote and bring a concept of premarital counseling and pre-pregnancy counseling camps. Raise awareness on increasing age when they want to try for a child, on their overall health and well-being and fertility options. Encourage men to participate equally in infertility consultation and change the narrative from woman's issue, then it is our issue. I think, then only things can be possible. Develop rural fertility health centers under the Ayushman Bharat, where, dedicated care is given in rural India. Make it a joy, not a taboo, to talk about fertility and aging through campaign, role model, people appeal, and respectful conversation. Thank you very much.
Thank you, ma'am, for taking this topic in such a simple way. You have explained everything. And I think we all need to get sensitized for this particular topic, that fertility rates are declining in our country. And if we start talking in different forums, I think that is another way. Like just we talk about endometriosis, just we talk about egg freezing. Similarly, we should start talking about declining fertility rates. So I will request all the chairpersons to take up this and say a few words about this hot topic. I'll say Dr. Sonia Malik, ma'am, I think she said that she's not able to join because she doesn't have a Google Meet. Dr. Sonia, ma'am, are you there?
I have joined.
Hi, ma'am. Hi.
Hi. Good afternoon, madam. Good afternoon, madam.
Welcome, doctor.
Welcome, ma'am. A few words. You were there on in that South Coordinate also to discuss this. So let's hear from you on the same.
I'm sorry I joined in late, but I know that ma'am has spoken about it at another forum also, and I was very much there. She always gives us real innovative ideas and her own thoughts about any topic that she speaks on. And hence, we tend to learn from her. That's how it is going on. And so, I don't have much to add except that it is a very grim thing that is happening. We are not realizing it now, but maybe in 10 years' time, we will realize that we chose the right profession. We were in infertility, which is basically now treated as not such a major this thing. What I should call thrust area for the government or for the country, because we are overpopulated. But we are seeing the tables turn as we are seeing the declining fertility rate. And each one of us who's now doing IVF is struggling to get the patients pregnant because the number of eggs or the number of oocytes that we find are declining. The type of patient that we have every day in our clinics is changing. And so also the men. It's not just the women, it's also the men. We find a declining sperm count as well as quality. More than the count, it's the quality which is affected. So for both men and women. So we need to take heed of that. This is not just our country's phenomena, it is a global phenomena. And WHO has actually given a call telling all of us to think about it, because in the year 2030 or maximally by 2050, they say that there will be only countries in Africa which will remain populous. The entire world is going to suffer from subfertility or infertility. We will be looking towards Africa to give us donor eggs. Then we won't have our own we won't have our own women and men to help us. So that is what the state is like, and we really need to take care of that. So one of the states in India which is very badly hit is Sikkim. Sikkim is it is a very small state, and interestingly, a woman empowered state where they are actually, there is 100% literacy in all the women over there, very much like Kerala. And so you find that the women are not getting married because they don't have the right kind of men to get married to, and also that they are waiting too long to have children. So, but the government has very seriously taken up this issue of declining fertility in Sikkim, because basically they have realized that this is a big problem with them. And Sikkim also has a rule like Kashmir that if a woman or a man marries outside Sikkim, they lose all the property rights and every right that they have in the state. So that is also very restrictive, and so there is hardly any, cross state marriages. Nobody from the eastern area gets married to people in Sikkim. So that is also a problem for them. So keeping all that in mind, the government has actually taken a very serious this thing, and they have encouraged IVF centers to start opening up over there. So, and the government is funding them. So in Sikkim now, they are proposing to give one cycle for 4 lakhs, 3 cycles free of cost, up to a maximum of 4 lakhs for each cycle. So I think that is a major step that one government has taken. So I think taking a cue from that, other governments should also initiate that. And we are finding that some of the states in the south, well, they say it is for a different motive, because the seats in the parliament decrease if you don't have that number of parliamentarians. Hence, they are very much interested to increase the number of parliamentarians. So they are opening up IVF centers in medical colleges. So that is the state that we are in now. But it is actually a very kind of a hearty change for all of us who are already practicing infertility, that we are now going to be much more sought after because of these problems. And because as doctors, we also have a responsibility towards the society. We should not let this happen, because like China, we will be left with only old age people above 100 in Japan and 60, 80, 90 in China, who don't have any youngsters to look after them. So that aging population will increase, and the pyramid which we have is definitely going to be like this, because there'll be more people at the top which are aged and very few young people at the bottom. With these, I think I can pass it on to someone else now to give their comments on the same thing. Thank you very much. Thank you so much.
Thank you very much. Thank you for taking out time and for your comments. Dr. Poonam Goyal. Dr. Poonam Goyal is there. Dr. Jyoti Malik, Dr. Poonam Goyal.
Jyoti is here. Jyoti is here. I can see her.
Hi, good evening, ma'am. Good evening, Sharda Jain, ma'am. And once again, I've also heard this topic from you the second time. The last time we heard it, I think, in the, where was it, Sunita? Where we had
Foxy meeting.
in the Foxy meeting. And that was the first time that this topic was brought. And this was brought by Dr. Rishma, ma'am, and her presentation, and then Dr. Sharda Jain's ma'am presentation opened our eyes, because we've all thought कि हम तो सिर्फ contraception के बारे में हमें बात करनी चाहिए इंडिया को देखते हुए. But when we saw the data that ma'am had presented, it was an eye opener for us, and in fact it was a good news for the infertility specialist कि now we have more business. We should not feel worried about it. And as Sonia ma'am has said that okay, सिक्किम में भी जाके हम अपने centers खोल सकते हैं, हमें अच्छी option मिल जाएगी उधर जाके. So that is, a good news for the infertility specialist that okay, now our business, as we also see that the more and more IVF centers are mushrooming. It is not because it is advantageous, but it is because it is the need of the time, I suppose. And more people are needing the infertility treatment. That is why. So, as ma'am has already suggested, and we all see it in our OPDs day in and day out, young girls having such low AMH, but matlab, we don't even, I mean, feel that is it right? Is the report right? And we get it done twice and thrice to see that young girl, 25-year-old with such low AMH. So it is such a, I mean, it is difficult to break that news to her and to then understand why it is happening. The semen parameters, the embryologist, every time they say morphology is so bad, so poor, we can't find good sperms for ICSI. इवन इक्सी में भी उनको स्पर्म ढूंढ ढूंढ के मतलब they spend hours to find good morphology sperm these days. So I mean the scenario is going very bad, from bad to worse, regarding the oocyte and the sperm and the semen qualities. And that's basically, I think, we all know environment, endocrine disruptors, the diet, and the late marriage, and all these are responsible. So but we need to work on it. And as ma'am has suggested, so many things. Her each slide carried such a big message, and I think nothing more can be added to that. And I think we should start following each particular PowerPoint that ma'am has suggested, right from Ayushman Bharat, making infertility more. Reaching it to the doorsteps, the common people should not feel, not burn their fingers. I mean, it should become more reasonably cheaper as compared to what it was previously. Then only I think it will work. And as Sunita said, all forums we should be talking about it. And creating awareness is the first and foremost things. Creating in the public forums, talking about it, talking at school levels, talking about the reproductive health with the school children. So I think, ma'am, we should start working. And you are the leader. You tell us, we will follow you. So we have, we'll do everything about it. Thank you, Sunita. Thank you so much.
Thank you, Dr. Jyoti. Dr.
Thank
you.
K Sharma, we want you to comment now fully. Sir?
Okay, ma'am.
I'm waiting for that. I'm waiting for his wise comments.
No, actually,
always very balanced, very balanced.
Dr. Sharda Jain ma'am had put the thing so clearly, and your inputs, Dr. Sonia madam, had further clarified so many things and what should be done in the coming future. And the point which madam had brought about the grandparent stipend, I think this is very, very important. I see many patients now, the grandparents are coming, or the parents are coming, the children are in the foreign countries, and they don't want to bear a child because there's no one to look after the child over there. So they want the grandparents to come along, and then only they will plan a child. Now that is an issue, and the Indians, they don't feel very comfortable there, because especially from the middle class who have never gone to the foreign, and if they have to go to Australia or some other country and look after their children's children, so they find it difficult over there. So if such a stipend is available, maybe that will be incentive for the Indian grandparents to go and help out the children outside. And secondly, you very rightly put up, there are foods which are injurious for fertility. So as in the cigarette boxes it is written, so government should say, okay, this food containing trans fats is injurious for the fertility, so that when the person is eating, he knows that if I eat this too much of kurkure or something like that, I will have fertility. So that can also be added to that effect. But definitely, I feel the problem which all of us are facing, and the new generation will face more, is the red tapeism in the treatment today. Getting the permissions every 3 years, there are so many compliances. So, there should be only one window compliance, not like somebody comes and says, okay, you put the DMC number outside the ultrasound room, and another fellow comes and says, no, next time you put it inside this thing. So I think that also will hinder the, the younger generation to get into this, treatment of infertility, they would say preferably gynae endoscopy is much better than this infertility treatment. So red tapeism also should go now, and there should be only a single window, sort of compliance. So that is one thing which I see in the future, because I had, when the ART bill came, my thought was very clear that now the child abduction will increase, and the women's, suicide, divorce, and the murder will increase. And you all see now in the newspapers, the children are being abducted from the colleges and other places, and this is going to increase only because the treatment is becoming costly, relativism is increased. So that aspect also we have to see as a society, so that we can help the poor infertile patients. So that is my main concern, because otherwise the rich people will get treatment anyway. It's the poor people, that medical colleges are not able to look after this because of the numbers which they have.
Thank you, sir. Thank you for putting in so many valuable inputs. Dr. Divya and Dr. Poonam Goyal, if they are also logged in, we would request.
Yes, logged in, very much logged in. Actually, there was one patient, इसलिए मैं बोली नहीं थी. I think everything has been well covered as of now. Everybody has suggested everything. One thing which I can add is that we can improve the workplace culture also, being pro towards this. Because workplace culture right now is like, अच्छा ये भी pregnant हो गई, ये भी गई काम से, ये वाली जो thought है ना वो बिल्कुल बंद होना चाहिए. You must be remembering the days when we were doing our PGs, so this used to be very unique comment from our teachers, ये भी गई काम से अब ये. So I think that can be improved, and more is that I think our government should provide incentives, like the government in the Sweden, they are providing the incentives for this, something like that, some tax benefits and some incentives. Rest all I think have been covered. Thank you.
Thank you, Dr. Poonam. Dr. Divya.
I think everything has been covered, but I just wanted to add to this fantastic deliberation that is going on now, that if you go to our agricultural land, if you go to our farmers, we'll see the kind of insecticides that they spray and the kind of hormones they inject into the lokis and the toris. And if you go to our granaries, the anaj mandis, you see the kind of pesticides they add over there. There is no government control over any of these things. And they say, and you know what they say, that the pests and the insects have become mutated. So they need even more quantity of the poisonous things. I think adding palm oil also, the government should have some control over the the fats that are added to make namkeens and packaged food and the outside food tasty. So all the refined oil at least should not contain particular things like palm oil, etc. There should be some kind of control. And of course, the Ayushman Bharat should start now looking into IVF also as a part of its own responsibility. So thank you so much for involving me. Over to you, ma'am.
So can I make one comment? What about genetically modified food? That is still a area unexplored.
So what exactly you want to say, Dr. Vanna? Genetically modified food is also
maybe they also affect, the grains coming out from there might be affecting the fertility as well, because right now they have said rice will come, which will need less water and it will yield more. So one doesn't know the nutrition quality, or maybe what genetic modifications they have carried out, what it implores for our humankind per se.
right. Very right. Thank you for your input. So yeah, anything else, Dr. Vanna, you want to say?
No, Dr.
I
Anita.
just wanted to add, Sunita, if I am allowed to speak for
Hi. Minute on.
this is Dr. Anita.
Hi.
Hi. I just want to add that we should not feel depressed about decreasing total fertility rate. It is, blood and sweat of Government of India spent over years since 1956
We have already reached the replacement level. Of course, the infertility is rising among the couples, but the fertility rate is the result of advanced family welfare options available, contraception available also. So it's not that fertility rate reflects the increasing infertility in general population. So we should not correlate both the things together. Government is very, very, prone to decrease the fertility rate, but it doesn't mean that each and every couple should have their own biological child. Of course, they should try for that, as our learned speakers have already told. But we should not feel depressed that TFR is going down, because it is the result of a good family welfare program also.
It
No, I
is.
think
I disagree with you, Anita. I think you have not understood the problem well. See, the thing is that yes, I agree with you. We have reached this stage because of the thrust on family planning. And that is why I said we are a populous country. So, therefore, we are a marginalized group. IVF and infertility has always been a marginalized group. We haven't been the mainstream. But what has happened to China? They started the one family norm, they forced it. They said, no, you can't have a second child. Just as we said two children, they said one. In 2005, they started this. And now in 2015, they had to reverse it because they found that the fertility rate was zero. And what has happened is that all the old people are left. There are no young people to look after their industry, look after their economics. So they had to reverse it. That is what we are scared of. That is what we want. We are very badly prepared for. You see, what has happened is Europe reached a level in 150 years. They have now, the reversal of the pyramid has taken place in so many years. In Asia, this reversal is taking place so fast, and we don't have facilities to protect the old people. Do you have any facilities for the old people? Nothing. So how are you going to look after all those old people? ठीक है, तेरे मेरे पास पैसा, हम अपनी ध्यान रख लेंगे. What about the poor? What happens to the old man and woman who are in the villages? Who is going to look after them? The children are here in the cities, looking for their
That is why. That is why. Yeah, that is right. Yeah, absolutely right, ma'am.
Don't take it so lightly. I
Yeah,
know it is because
ma'am,
of the
that is why
programs.
government
It
is
is a
now
serious problem.
government is now planning to open IVF units in each and every medical college. They have
Exactly.
already sent the letters
Why
to
are they
all
doing it?
medical
Why
colleges.
are they doing it then?
Yes.
It is looking at us. This problem is faced. We have to face the mirror. It is looking at us. That's why I'm saying. And
Agree.
thank God for it. Thank God we are not. Whatever Dr. Sharda Jain is saying is making sense. Thank God.
Yeah, I agree that.
पहले तो हम पे हंसते थे ना, क्या ये सारों को
It
IVF
is
ही
not
करते
just
रहते
the
हैं.
family
अब पता
planning
चल रहा है
measures
कि
that have
जरूरत
brought
है.
down. No.
ठीक है?
It is
Sorry.
a
Sorry for
wider
interrupting.
issue.
Sorry for
Patients have
interrupting.
changed, you will find youngsters have such a low fertility potential. You feel very sad about it. There is some change is taking place. Over to Sunita.
So I think the point is put across very well by Dr. Sonia Malik ma'am, Dr. Sharda Jain ma'am, Dr. Sharma sir. And we need to talk more and more about this, that yes, our fertility rates are declining. And Dr. Anita, if it is going below a certain, level or points, then it becomes irreversible. This is what we need to understand. And few important points which everybody has put across, and I would like to just sum up in 2 minutes is, we should talk about insurance companies covering infertility treatments more and more, so that, people, it becomes accessible to people. All gynecologists should talk about fertility levels or fertility testing at earlier stage rather than lingering on it. If the girl is not talking about fertility, she should be going ahead and discussing how you can assess your fertility and all those things. Discussions should happen amongst young population, school levels, colleges level. That's very important. All of us are seeing this. Our children say that we don't want to get married. Like, it is so hard. Our own colleagues, they are finding it hard to tell their daughters that they need to get married on time and freeze their eggs. So everybody is saying no to marriages and no to, obviously, then fertility also. And endocrine disruptors. This is something I think we should have, ma'am, more CMEs on this, because we need to kind of reinforce this, the way we are using all these things, perfumes and lipsticks, as Dr. Renu also talked in one lecture. So for the same reason, we have put another topic today, which is declining male fertility, which Dr. Shalini is going to take. And